Week 4 persuasive speech. Frankie Lee is the speaker. Here's my audience, and I'm now turning the camera over to my cameraman. According to the World Research Foundation staff of 2018, when you are sick, you have no choice but to think about your health. It's right in your face. You feel awful. Good evening. I'm Frankie Lee, and I've been a nurse for 40 years. Preventative health care seems very boring and mundane. It is not really something a person thinks about every day usually, not until you or a loved one become ill. I spend an average of 12 to 15 hours a week talking about preventative health care and the annual need for a PCP evaluation for members just like you. Preventative health care through annual PCP visits is important because it is first step to the positive outcomes in your day-to-day health care and your life. The empowerment of self-care management that you can do in your home environment. And it controls the costs for you and your loved ones in the face of rising healthcare costs in the industries. The costs always seem to land on the consumer, you. Let's discuss how you can do this for you and your loved ones. Annual preventative PCP physicians can help you stay healthy day to day. Catch the illness before it's a train wreck. Per the staff at the CDC 2017, preventative disease before it starts is critical to helping people live longer, healthier lives, and keep health care costs down. Most individuals understand that they require some sort of health care maintenance, but not everyone follows the path that the care needs. We now understand that your day-to-day life can be disrupted if you become ill. I would like you also to understand what the disruption can do to your ability to stay in your home and manage your own health care. You may not be able to manage the outcomes of your care without preventative care. Maybe not be able to stay in your home, or maybe the others will need to manage your care for you. According to the Office of Disease Prevention and Health Promotion staff, 2018, access to health care impacts one's overall physical, social, and mental health status and quality of life. If you wish to stay in your home and self-manage, it is important that you get annual physical tests that you may need to prevent you from becoming ill. We have talked about the need for preventative health care, the need for an annual physical assessment and evaluation. This will give you a better day-to-day quality healthcare outcomes. By going to have an annual PCP physical evaluation and making sure that your loved ones have this visit, you have empowered yourself and your loved ones to the healthcare needs in the home environment. Now let's discuss the financial impact of the PCP visit. The average PCP copay can be anywhere from $0 to $30. The average is $20. Urgent care can cost you a $50 bill if you go to the urgent care for that visit. If you end up in the ER, it can cost you $150. Quoting Frontlick and Attell, imagine how difficult it would be to get all the care you and your family need to stay healthy without primary care providers. That was in 2013. Mounting costs for healthcare today require consumers, you, to get care in the right place at the right time for the right cost. By managing your healthcare like any other financial process, by avoiding higher costs by using cost alternatives such as the primary care office. We look to taking the first steps to the positive day-to-day outcomes in your healthcare lives. And then we discussed your empowerment for yourself and your loved ones in self-management for your healthcare in your home. We have also reviewed that there may be more cost-effective for you and your loved ones as consumers to use the PCP preventative annual evaluation to reduce financial burdens of healthcare. Don't wait until an emergency or you have a crisis before seeking health care that you need. Take control of your health care and your life by accessing preventative health care available to you and your loved ones through the primary care physician. It is important as human beings that we take care of ourselves and our health and welfare. If you don't do it, nobody else will. I beg you, please, if you do nothing else from today on, seek out that primary health care visit at least annually at the beginning of the year. Most people do it through January through March, and do it every year thereafter in order to be sure that you maintain good health care to the end of your life. I thank you for your attention, and I wish all of you good health. Thank you. I will now videotape my audience again. Timer off. And audience number 1, audience number 2, audience number 3, 4, and 5. Thank you again and have a good evening.